Alaikum. Can you hear me? Ms. Fouzia,
I can hear you. I can hear you.
So should we wait for a few more people or should we start, Dr. Asad?
Kiran, I think we can wait for, I think, another 2-3 minutes so we can quickly go through a round of introductions.
Yeah.
That will be better.
Okay, I'll start with myself. I'm Kiran Amir and I'm an administrator in Psycho Pakistan and looking after some Super Hub program as well. So I will now ask Dr. Amna to introduce yourself.
Assalamu alaikum. I'm Dr. Amna, and I'm an eco facilitator and PAM lead, and I work in the Fatima Memorial Medical College.
Dr. Altaf Alam sir.
Thank you, Kiran. I'm Professor Altaf Alam. I'm Professor of Gastroenterology and Hepatology, and now working at Evercare Hospital, Lahore, Pakistan. Thank you very much.
Dr. Asad.
Assalamu alaikum, everybody. I'm Dr. Asad Chaudhary. I'm joining from Gujranwala, and I'm director of this Psycho Pakistan. And really excited and looking forward to today's session for a change and looking ahead to more collaboration and more sessions on mental health in future. Thank you.
I think Uzair, can you unmute yourself and do the introduction?
My name is Uzair Reddy, currently working as project coordinator at Psycho Pakistan. With me is my colleague Haris, who is working as IT professional over here. Thank you.
So, Dr. Bhutta Saab.
जी अस्सलाम वालेकुम। अस्सलाम वालेकुम, आवाज आ रही मेरी?
जी
हाँ जी तो मेहरबानी जी। आई एम फ्रॉम ओकाड़ा, आई एम प्राइमरी केयर फिजिशियन और आपका ऑनलाइन प्रोग्राम सारे मैंने अटेंड किए हैं, सारे लेक्चर्स, और फिरोज सांस का और प्रोफेसर असद अली चौधरी साहब का मैं बहुत ज़्यादा obliged हूँ। मुझे तो उन्होंने घर बैठे बिठाई हेपेटोलॉजिस्ट बना दिया है। Thank you very much.
Thank you for the lovely introduction. Meera.
Assalamu alaikum. I'm Meera Blodhi, working with Rosen as a project lead.
Thank you. Sikandar Sahab. I think Khwaja Arshad Sahab. I think we can start with the introduction, Dr. Asad, with the session.
There are couple of people left. Khwaja Arshad, आप अपना introduction कराएंगे, please. If you can unmute yourself. We also have Mehak Junaid. If you can introduce yourself, from where you are joining.
Hello. Assalamu alaikum. Me and hello.
Okay. Just पहले Khwaja Arshad, आप अपना introduction कराएं, please.
जी. Assalamu alaikum. Dr. Asad Chaudhary. My name is Dr. Fouzia Arshad. I am working in family care, family medicine, settled in Lahore, Pakistan, Punjab.
Thank you very much, sir. Thank you.
Okay. Thank you, Dr. Asad Chaudhary. Thank you.
Mehak, आप अपना introduction please कराएं.
जी, अस्सलाम वालेकुम sir. I am resident in JPMC Ward 7 under supervision of Dr. Zishan Ali.
Excellent. Thank you. So you're joining from Karachi. So
yes, sir.
Aaj, आप अपना introduction कराएंगे, please.
Ji, Assalamu alaikum. My name is Dr. Aaj. I'm currently working as a medical officer in Chaudhary Hospital under Dr. Asad Ali Chaudhary.
Thank you so much.
Thank you.
Kiran, over to you. I think it's okay.
Dr. Fouzia ka I think introduction मैं करवा रही हूँ. So let's begin. I welcome you all to our first TeleEcho session in collaboration with Rosen on mental health during COVID-19. Parsa Echo Pakistan has conducted various sessions regarding COVID-19 in past year, and you can find these videos on our YouTube channel. I'm Kiran Amir, as I've told you before, and I'm working as an administrator and director operation at Parsa Echo Pakistan. I'm the co-facilitator for today's session. Along with me, Ms. Meera Blodi, project lead Rosen, will co-facilitate, and especially during the question answers and recommendation session. We have today with us as an expert, Ms. Fouzia Yasmin. She's a clinical psychologist. She's working as a senior manager in charge counseling women and children program at Rosen. She's graduated from University of Melbourne in development studies, ADCP Punjab University, and MSc Psychology, Punjab University, Lahore. Rosen has been very active in COVID response. They had a dedicated nationwide psychosocial counseling helpline. Resource material on COVID-19 and mental health issues were available. Online training helpline for various organizations on psychosocial support were provided, and some ration distribution to communities as well. Rosen has the mission to collectively work with individuals, vulnerable groups, and institutions on promoting emotional health, tolerance, gender equality, and reducing violence against women and children. Before I hand over to Ms. Fouzia, some standard announcements. We are part of a global movement called Project ECHO based in New Mexico, USA, with an objective to disseminate knowledge and best practices. We do protect patient privacy, so none of the material used in today's session will identify any individual or patient. For maintaining discipline, you all are muted, but we do encourage participation. So you can unmute yourself after presentation and use the raised hand option or the chat box for questions. For CME credits, please contact Uzair, our coordinator. His number is mentioned on the banner. So without further delay, I will hand over to Ms. Fouzia Yasmin.
Thank you for this generous introduction of Rosen and myself also. आपको मेरी आवाज आ रही होगी? I hope you can hear me. Okay, good, great. So just to give a snapshot of today's discussion, and thank you very much for inviting us, first of all, on this platform and to talk on this much needed but much ignored area. In this 1 hour, I'll try to capture through. We will present some of our call data that we received on our Rosen Counseling Helpline. That will give you an overview of what kind of complaints we are receiving regarding mental and emotional health. What are the challenges we are facing here? Overall, this sector is facing here. What are the recommendations at the end? So I'll start with my presentation. I always have challenges in opening the presentation, but I hope I can do it. Can we see it? Are you able to see it? Presentation.
Perfect.
Yes, Fouzia.
Okay, good, great. Okay, so mental health during COVID-19. I'll start from Rosen introduction. Rosen was basically, as we said, is working on promoting emotional health, tolerance, and equality, and reducing violence against women and children with our areas of expertise is training and capacity building, awareness raising, counseling, psychosocial support, advocacy, and research. Rosen was basically founded by a group of psychologists and a group of psychiatrists in 1998. And it was based on the need, on identifying the need of the psychosocial area, in the psychosocial area of the community needs. So हमारा शुरू से ही psychosocial contact के साथ एक बहुत गहरा close link रहा है. Rosen is working towards 5 programs. Angan is basically, as you can guess from the name, is working on the children and with a very special focus on the child sexual abuse. And Angan is basically working like from 1995, which is basically 3 years before the Rosen started working. And those days, no one actually was working on the child sexual abuse. So Angan is basically working since 25 years on this issue. Then we have program of Z's, which is working with the woman, survivor of violence specifically, but also on the mental and emotional health of women in this country. Rabta is our program that is related to police reforms, advocacy initiatives. It is also working directly with the police. And then we have Rosen Counseling Helpline, which is working since 2 decades. And we're receiving, this is one of the pioneer helpline in Pakistan, which was providing psychosocial support to the community. It has been working since 2001. And then we have another program which is working with the men, because we believe working with women is not enough whenever you start working on specifically on issues like violence against women. So we've also worked with the women, with the men also, and through our Men Engagement Alliance program. And you can see this model of Rosen. So you can see the women and children are basically the main focus. The interventions can be different. This is Men Engagement program, police program, community interventions, counseling helpline, but the main beneficiaries are the women and children of our programs. So this was a little bit of snapshot of Rosen. Before going further, I think before going into what happened in the mental health issues during the COVID, this is very required to understand what is the situation of mental health in Pakistan. So there is a huge mental health burden before the COVID also. There's like some of the studies, there is no as such statistical data available, but there are some studies who are saying there are about 20 million people Pakistani are having mental and emotional health problems. Pakistan has one of the lowest psychiatrists, 2% ratio in the world. Or according to WHO ke mutabik, only 400 psychiatrists are existing in the country, and there's only 5 psychiatric hospitals there, which are basically covering the population of 180 million. According to the WHO, there should be one psychiatrist to almost 20,000 population, but we have one psychiatrist to like millions of people. So very, very low services available, expert services available in this area. We have less than 1% of GDP that can be spent on healthcare. And this is not mental health care. This is the overall healthcare. So, and you would know because you all are doctors in this area, so you would know. And mental health, there is no as such specific budget for the mental health. So this is included in the overall budget of healthcare. And WHO, as you know, is recommended at least 5% of your budget should be designated for this area. There's a very low mental health literacy. People लोगों के बहुत सारे stigmas which are attached to the mental health issues. People who are having the mental health issues are not going to the psychiatrist and psychologist. They are going to the other resources, चाहे वो पीर हैं, पीर फकीर के पास, because there's a very strong stigma attached to the people who are going to the psychiatrist, and they are considered as the pagal or insane. As I say, there's a lack of standardized protocols and guidelines, not just for the counseling, telecounseling, but also as overall for the counseling also. So if you want to know what kind of standardized protocols that should be followed to provide the psychosocial support services or the psychosocial first aid or the telecounseling, you may not be able to find any standardized protocols or procedures or guidelines. The challenges that were specific to COVID-19 were also many. There was a very clear spike in the mental health issues in the COVID-19. This was observed and seen not only by the Rosen, but also by the other organizations as well who are working in this area. There is just lack of expertise, of course. जो जितनी नीड थी, जितनी comprehensive, जितनी ज़्यादा नीड निकल कर COVID-19 में, उतने comprehensive support services, expert services were not available as compared to that. There was a new area identified in this period, which is the telepsychiatry or telecounseling. And हमारा जो एक convention one-to-one counseling model है, that was not working during the COVID-19 and lockdown situation, and people had to go to the helplines or the online psychiatry, which was there was a very clear resistance because people were not used to this kind of counseling, receiving the counseling or receiving the psychosocial support. There was very many issues related कि अच्छा हम कॉल तो कर रहे हैं, कॉल के साइड पे कौन बैठा होगा, वो कैसे बात कर रहा होगा, कॉन्फिडेंशियलिटी कितनी मेंटेन हो रही है, नहीं हो रही है. So there was a very, very clear resistance for the people who were receiving the tele-counseling or tele-psychiatry, which is very understandable in the context of our country. जो response state की तरफ से और बाकी organization who are working on this area, उसमें government ने शुरू में they gave the 26 pages document providing guidelines to manage psychiatric impact of COVID-19, which provided the basic infrastructure regarding how to deal with the tension, stress, anxiety during the lockdown. Unfortunately, many of the people don't know about this document. This was not provided to many of the people who are working in this area. Government did try to develop cluster groups, subcommittees for the emergencies, mental health response, that included the psychiatrist and psychologist. There was many trainings were being done in those days for the non-specialized workers. Many checklists were developed, many modules were developed, which were given to the healthcare so they can identify the people who are having these mental health issues and the people. And also there was training were being done for the, so the people can not just identify, but they can also provide the psychosocial first aid to the community and to the large population. The MHPSS is basically mental health psychosocial support communication strategy was used by the government and the organizations, the messages addressing stigma and dealing with the isolation, etc. And we can see a number of helplines during this period. Some of the helplines were new. Some of the helplines were working already in this sector, but they started giving, for example, if the helpline is providing services to GBV survivors or any other survivors, they also started giving the psychosocial first aid or the counseling through their helplines. So we saw a number of helplines working during this period. So this was kind of integrated state and non-state response towards the psychosocial needs of the community. It was being done by the government and other organizations as well. Rosen Counseling Helpline in this sector, Rosen basically, it's been working since 2001. Rosen has seen many disasters and emergencies during these 2 decades, like flood, earthquake, or a very understandable fact that during any emergencies, psychosocial needs बढ़ती हैं community के अंदर. So when the pandemic happens, we were quite ready for that, because there will be huge number of calls. There were a huge increase in the number of calls that we can receive on the counseling helpline. Or well, exactly वैसे ही हुआ. Initially, we had 3 to 4 counselors. Before the COVID, we had 3 to 4 counseling in our helpline. We updated our helpline. We included 7 to 8 counselors into it. Initially, it was working 5 days a week. We had to increase it to the 7 days per week, and we also increased the number of days. And during this we actually received lots of calls, which is like, according to our data, we received 4,368 calls from April to December. If we compare it from the previous years, that all the Rosen Counseling Helpline basically इसमें का 2001 से काम कर रही है, and they are the counselors who team of trained counselors who are और हम अपना number different campaigns के through promote करते हैं. People are calling us from all over the Pakistan. अगर हम compare करें as compared to 2019 call letter को, you can see we received only 475 calls in 2019. Whereas we received almost 66 calls during the 2020, which is the difference of almost 4,000. So you can understand how much need was there, how much people try to reach out. The important, interesting factor here, because we had a team of 7 to 8 psychologists, and even that team was not enough, because we also have the caller portal in our systems, and we were checking how many calls actually fall on that system. And at the end of the December, we had this number that almost 28,000, more than 28,000 people tried to reach us. But because there was a huge number of incoming calls, there was a huge burden on the portal, we were able to give psychosocial services to only 4,466 clients. And the rest of the calls were unfortunately dropped because of the numbers were very, very busy. So you can see how much the need was there, especially in the initial time of the COVID, and how much people were interested to find if there is service, is there any help available in this area. There's also an interesting factor that you can see there are more female, the number of female callers is is quite high. It's 2,675, which is like 61% of the calls were received by the female as compared to 39% calls were received by the male callers, which is also another interesting factor. We have seen in the previous emergencies and also in the 2 decades of Rosen history that male callers tend to call more, and we receive more calls from the male callers, mainly because they are the medium of telecounseling is more accessible to them. But during this period, we receive more calls from the female as compared to male. This is the age group kind of and you can see we receive 44% of calls we receive from the early adulthood. And when I say early adulthood, that means 20 to 30 years of age. We also, and then the next bigger chunk is from the late adulthood. This is 31 to 50 years of age. So you can see we receive most number of calls from the age range of 20 to 50 years, but we also receive the calls from the children which are lesser than 20 to 12 years of age, or people who were more than 50 years of age. areas, we received most number of calls from the Punjab, but we also received the calls from the GB and Federal. One interesting fact about the areas is that we received the calls from the very far area, far-reaching areas, like some villages around Punjab or some villages around Muzaffargarh or Jagbabad, or places where we normally don't receive the call from those places. But चूँकि हमारी एक campaign जिसका मैं आगे चल के जिक्र करूँगी was running on the national channel. So our message, our promotion campaign, our awareness raising campaign was reaching to very far areas of the country. So we're receiving calls from there. And sometimes because we also have a referral system, we are जो हम इस system के through use करते हैं, it was very difficult for us to refer to people to the available sources because वो बहुत दूर से calls करे थे, and sometimes very difficult to find कौन एक ऐसा available psychiatrist हो सकता है इस area के अंदर. For example, if someone is calling from the far areas of Jagbabad or Muzaffargarh, it was difficult initially for us to find out the available resources in those areas. And for that, we actually updated our referral list also during this time. This is the sources of call, and sources of call का मतलब ये कि whenever someone is calling us, we ask them how did you know about the Rosen Counseling Helpline? And people are telling us we saw your video or flyer on the PTV or the social media or the Facebook, etc. And we try to understand how the media campaigns works. And we have seen that and you can also see that 69% of the calls were received by the electronic media. And this happened when we had very, very strong promotion campaigns that were talking not about the promotion of the helpline, but also they were giving the awareness regarding how to deal with the stress and anxiety during the COVID-19, how the people can reach out to these services, etc. So we received maximum number of calls to the electronic media campaign, which was done on the PTV home. And there are a number of factors behind of this huge number of calls coming from there, because this was PTV home was basically seen and viewed by the woman. और वहाँ से हमें ज़्यादा calls इस वजह से भी receive हुई, but also it was a national channel. It was reaching to the whole country, many far-reaching areas, many far-reaching villages, and that's because कोई huge पैमाने पे campaign हुई that we received the maximum number of calls from there. We also received calls from the social media, like Facebook and Instagram and Twitter. And one interesting factor was that we received more calls from the PTV. Female callers were calling from the PTV sources of information, whereas the male callers more calls were received by those who saw our promotion campaign on the social media. So I think social media पे ज़्यादा उनकी access थी, यहाँ पहुँच थी, यहाँ देख रहे थे, जबकि ख़वातीन ज़्यादातर PTV को देख रही थी. So most of the calls coming from the PTV campaign was of female callers. If you have any question, you can write down in chat box. I can address at the later stage. We also had we also received the calls of the gender-based violence. We received almost 484 calls during this period. And this is also, again, a very, very interesting analysis, because in 2019, we received only 38 calls on the gender-based violence. But in 2020, we received almost 487 calls. Which is again the 400 times higher than the 400 times higher than the previous number. And of course, this is because of the fact that gender violence increased during the 2020 by significant number and frequency. Mental health issues जिनके ऊपर हमें ज़्यादा calls receive हुई, they were various. जो हम club कर सके कुछ चीज़ों को, we have seen, you can see the bar of functional disturbance is the highest, because people were having the physical complaint in the Pakistan, because people don't have a realization or understanding of the emotional health issues. So जब तक कोई physical आपकी emotional health issues physical complaints में convert नहीं होते, people are not coming to you for the help. So whenever they are having some physical change in their body or stressed, only then they are going to call you. So in functional disturbances, in anxiety, in depression, we receive the highest number of calls. But we also received the calls from the people who were having financial worries. There were different streams of callers. There were callers who were calling us because of the direct impact of the COVID, because they were having the symptoms of anxiety or the depression or other things because of the fear of infection, because of the fear of virus or death. But there are some other people who were calling us because of the indirect impact of the COVID-19. So people who have the financial worries because they lost their jobs, they lost their daily vocational opportunities, and they were very strong financial worries, especially when the lockdown started. So there are a huge number of calls that we received regarding the financial worries. There was a time then we actually sit down and we started and we looked at our campaign, okay, why the people were calling us because of the financial worries. And we realized this is not just because of our campaign or anything like that. This is basically because लोग इतने ज़्यादा worries थे कि any kind of silver lining जो कहीं भी नजर आई, they were reaching to that in the hope to get help. एक और बहुत interesting factor that we realized during all this analysis, whenever you use the word help or madad in your campaign, people very quickly were associating that word with a financial help, because that situation was quite high for the people because of the lockdown. So in every campaign, in everything, they were relating every kind of help with a financial help. And Rosen basically was not providing the financial help during those days, but because the need was so high that we tried to identify the organizations who were providing the financial help to the people, and we connected those callers to that organizations, or even with the government assessed program as well. These are the presenting complaints that people call us with, like for the anxiety, they were having heartbeats, breathing rapidly, sweating, trembling, feeling weak or tired, trouble in concentration. They were having trouble in sleeping, of course. They were for stress, they were having pains, chest pain, exhaustion, headaches, high blood pressure, muscle tension. In functional disturbance, they were coming with नींद नहीं आ रही है, नींद आती भी है तो रात को डर के मार उठ जाते हैं. There were many complaints regarding the lack of concentration, fatigue. They were eating problems as well, headache, dizziness, lack of energy. We also see a quite change in the trend of presenting complaints by the callers. For initial set of few months, we were receiving calls more regarding the anxiety. चाहे वो physical symptoms हैं, चाहे वो वैसे symptoms हैं कि दिल घबरा रहा है, but they were more related to the fear and tension of the virus and infection and fear of death also खास तौर पे. But as the time guzara, we have seen that there was a shift in people, because initially there was a fear and there was a stress, there was anxiety, but there was also a hope that it will be okay in a couple of months. And वो जब नहीं हुआ in a couple of months, चीजें ठीक नहीं हुई. We also see a trend in people that they were more depressed, there was more lack of energy, there was more dizziness, there was more sleeping problems, because जो डिफेंस मैकेनिज्म लोगों का शुरू के मंथ्स में बहुत अच्छे तरीके से प्ले कर रहा था, that actually got exhausted in the later months. And the last few months we have seen people very strong symptoms of depression. जो हमारा qualitative data जिसमें पहले का, there was two streams of data, the people who were calling who were having the psychological disorders, relationship issues, or the emotional problems before the COVID-19 also. But then, but these issues or these emotional problems were actually got aggravated during the COVID-19. And then there was also a stream of callers who were calling us because they were having new symptoms of anxiety or OCD or depression. And they are saying कि पहले नहीं था, लेकिन now we are having all these symptoms. So basically there was a direct or indirect impact of COVID-19 on the psychosocial health of the people, a direct impact because of the fear and anxiety. We also have seen that a difference between this emergency and the previous emergencies as well. So for example, पीछे earthquake भी हुए, flood भी हुए, कुछ और emergencies भी आई पाकिस्तान के अंदर. But the people were having kind of very strong resilience. They found very strong resilience in them. So once the grieving period is over, people were active. They tried to build up their lives again and again. This pandemic, we have seen this difference because there was no answer to any question related to COVID. So then they were going to expert. They don't have any. No one had any answer. किसी को नहीं पता कि कब खत्म होगा, इसका impact कब खत्म होगा. So there were rumors also कि अच्छा गर्मी में खत्म हो जाएगा. 2 months के बाद things will be okay. And when things were not okay, तो एक fear of uncertainty वो बहुत ज़्यादा था. And whenever there is a fear of uncertainty, there is a very strong sense of loss of control over their lives was there. और उसकी वजह से बहुत सारी fears, बहुत सारी anxiety जो थी वो develop हुई. financial worries, जैसे मैंने पहले कहा, people were calling us because of the financial worries. इसमें भी 2 streams थे, people who were calling us directly कि हमें financial help की ज़रूरत है. But then there was people who said कि because of the financial worries we are having anxiety or depression or other symptoms or psychological symptoms. One stream of callers were those who were having the relationship issues, और वो भी बहुत high था because this was one situation when people, one of the unique situation when people actually had to coexist in closed spaces. इसी पहले social setup was like that. People, husband were going to their jobs, children were going to their schools, housewives were working, housewives, they have their own routines. But during these lockdown periods, especially, all of them were living at the very same space, in the very close space. And relationship issues because of that factor were बहुत high way. Similarly, children behaviors related problems बहुत सामने आई. One issue was that everyone has their own way of expressing anxiety or fear. So my elders का एक set of style है to express their anxiety and the fears regarding the infection or the virus. Children have their own patterns of expressing those fears, and they were like उनके behavioral problems बहुत ज़्यादा हुए, aggression problems बहुत ज़्यादा हुए, and that the issue ये था कि parents, the elders of the family were not able to understand and they were not able to manage those. So वो children related, behavior related problems बहुत ज़्यादा सामने इस अरसे में आए. Anxiety related to COVID symptoms, जैसे पहले का जो direct symptoms थे उसमें COVID से related fear of uncertainty, fear of death बहुत ज़्यादा था, और people were not able to manage their stress during this period. इस सब के साथ साथ we have also seen a very good patterns how people were actually helping themselves through the self coping techniques, and one of way of providing psychosocial support to the clients or to the callers was also हमसे पूछते थे कि आप इस situation में आप क्या कर सकते हैं, what are you doing actually to help yourself. And we have found कि कुछ patterns we have seen through which community help themselves and they build their resilience. For example, religious beliefs and practices we have seen लोग इस religion में खास तौर पे they are very close to religion, and that basically religious beliefs and practices help them. वो कुछ जगहों पे बहुत problematic भी था, where people were not following the precautionary measures because they feel कि हम 5 times दिन में वज़ू करते हैं, हमें cover नहीं हो सकता. But at the very same time, it was also helping them at some stage also. Self-care के attitudes काफ़ी सारे नज़र आए बहुत सारे खासतौर पे urban areas में. People who were more into outward activities, when they have to live inside the house or फिर jobs भी नहीं थी, so they were more into inward अपने लिए क्या किया जा सकता है. तो self-care की activities ऐसी जो कभी हमने इनको advice की, कभी उन्हें खुद से adopt की, लेकिन उसने उनको actually में बहुत help किया. Music and entertainment programs actually help them to divert their attention. Volunteer work. इसी तरह से online business earning opportunities बहुत increase. We have seen number of people who went online to start their business. Already business कर रहे थे, they also went online. Especially women, we have seen lots of women starting their business during this period, and that business strategies or earning opportunities actually help them to cope with the situations. And of course, also the indoor activities. बहुत ज़्यादा हमें लोगों में देखी वो use करते हैं the coping techniques. These are the few stories that you can see that I can share. 35 years old caller called helpline to get support for anger management and homicidal thoughts. She shared she has anger outburst with her mother-in-law and sister-in-law, and she was worried about having homicidal thought of killing her mother-in-law. She also shared that she is being physically abusive to her children and needs support to overcome these problems. And after a few sessions, caller shared that with the help of counselor, I explored that all these anger and homicidal thoughts were the outcome of emotional and economical violence. And after talking to a counselor, I realized that I was not insane and all my emotions were natural reaction to the violence. And I went through the process of visualization of my feelings of guilt, sadness, helplessness, which helped me feel relaxed and calm. Now, the one way of जो एक चीज़ हमें बहुत help की during all this intervention and during all this counseling was to make the people realize that these, whatever they are feeling, whatever the anxiety and depression symptoms they are having, this is the normal reaction to an abnormal situation. So people were calling us, अच्छा हमें लगता है हम पागल हो गए हैं, हमें लगता है कि हम नहीं ठीक function कर पा रहे. But when we make them understand that these are the normal symptoms, और किसी भी ऐसी pandemics में symptoms या किसी भी ऐसी emergencies में ये चीजें reactions normal हैं, and these are the normal reactions to abnormal situations that actually help them to cope with the situation, and that actually helped them. They are not alone in this situation, and there are other people who are having the same situation or maybe having the same symptoms. Or derealization or just psychoeducation basically help them a lot, especially in the context of our society where whenever you have a feeling of anxiety or depression, people will be able to insane very easily. So context and the derealization we found very helpful whenever people have that. Similarly, a female client from the suburbs of Islamabad called Rose and helpline for financial assistance. She was crying, seemed emotionally distressed, having symptoms of physical symptoms of extreme stress. In exploration, she shared that she is living in a rented house with 4 children. Her husband worked on daily wages. Or at the outbreak of COVID-19, he did not get any work and they don't have food to eat and no one is supporting them. And she wanted support from the helpline. And the counselor, after validating her feelings, shared about the helpline and connected her for ration and financial support with other alliance organizations. She called back after a few days with a much strong voice and thank you, and shared her need to continue discussion about her stress. So this also happened in a number of cases, other cases also. The people were calling Rosal helpline, not because they are for the psychosocial support, but for other reasons as well. So people were calling for the financial worries, financial help. And whenever the financial help was provided, and whenever it was resolved, they called again and they said, no, we want to work on other areas as well, for other areas of our life that requires detailed counseling. So we want to have detailed counseling sessions with you. So one way of help, one pattern of callers was also that, also like that. In one of the case study, it was 50 years old male, married, having 2 sons, he was jobless. He came with the physical symptoms of breathing problems, fatigue, body aches, dizziness. उसको anxiety के symptoms, of course, उसकी fear of death था, unknown fear था, breathing issues थे, agitation वगैरह. Because he lost his job due to COVID-19, he was isolated at home. He had unhealthy relationship with his wife, or living at home all the time was very challenging for him. Or it was not just for him. I think the number of male callers who called us, they said during the lockdown that living at home all the time and not having that power of going outside was quite challenging and quite tough psychologically for them. Our counselor, we have basically another counseling number. So people who want to have detailed counseling, they were transferred to that counseling number. So our senior counselor did catharsis with them, helped them to have a catharsis, psychoeducation, breathing exercises. और इसका impact ये हुआ कि they felt relaxed and have the resilience to cope with the stress. Sita, there was 35 years old married housewife, had 1 daughter, and she had sleep disturbances, stomach problems, acidity, muscular pain, and there was symptom of OCD. She was at her mother's home due to the child delivery, and after COVID, she became very fearful and her OCD actually got aggravated. She was not allowing her husband and the family members to come closer to her daughter, and she was then abandoned by the husband. Counselor did help her through the catharsis and breathing exercises and the psychosocial support, but she was also referred to a psychiatrist for the medicines because of her OCD symptoms. And she is still with our counselors. This is a material that we designed and developed during this whole period. This is the screenshots of some of the videos that we used. You can see we invited our expert and we asked them to give us the awareness regarding how to deal with the coronavirus, how to deal with the lockdown situation, coronavirus situation, and the stress, not the situation, but the stress related to these situations. We also developed some animated videos as well. This is the flyers that we developed during this period of time. These were also regarding the women and children COVID-19, but also regarding the stress. And these were the promotional material of Rose and her counseling helpline that we used on the social media. We had a very good response on the social media as well. I think there was the number of engagements, social engagement that we received on social media was in very many thousands. Documents that we produced during all this period. One intervention was of Rosen was also to train the other helplines as well. And as I earlier shared that there was a number of helplines that appeared during this time period. Or there was many complaints that many of the helplines were not very trained people, but they had the degree, but they were not able to provide psychosocial support or telecounseling. So there was a huge need of training and capacity building. we develop materials, the training materials on the psychosocial support, and we train almost 200 service providers. That included the people who are working in the helplines or in the social welfare departments or in the developments, or people who had the direct contact with the community. Most of the people that we trained were in the government, were from the government sector, because government has a more outreach. So in the hope that the whole psychosocial support intervention can reach through this to more number of people. These are few pictures of our training. These are all online trainings. We had to do the online trainings because of the COVID situation. So the recommendations is not just from the Rosen observation, but we did collaborate. We did many webinars also on these issues, and these recommendations were given by the other mental health experts who are working in this area. One of the recommendations was that there should be integrated health policies that can focus on mental health. As I shared earlier, there is no guidelines or set protocols for a comprehensive response. So there's a strong need for integrated health policies. There was also a recommendation that there should be 24-hour assistance to the public. Many of the helplines were working 5 days a week. Our own Rosen helpline was working like 7 days a week, but also for the 10 hours per day. There was a need 24 hours, 7 days a week helpline for the psychosocial support. Rehabilitation center across the country for mental health needs. As I said earlier, there are only 5 psychiatric hospitals, and the need is very, 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 very high. So there should be more centers, more that can have experts with them, and then can provide psychosocial services. Also, the initiatives should be extended to the rural areas. Like I have said, that when the campaign that we used would actually reach to the rural areas, and we received calls from them. But most of the helplines were working in the urban areas, and rural areas were much ignored. Not just the initiatives, not just the helplines or the resources, but also the awareness raising initiatives should also be extended to the rural areas. And there was also suggestions that these messages, most of the messages were in the Urdu language, which is one reason we received most number of calls from the Punjab. There was a suggestion from the other areas of Pakistan that these messages should be converted to the local languages, so the people from the rural areas, especially the women and children, can understand those messages. The media awareness about COVID-19 through experts is very, very important. As I have shared earlier, TV electronic media campaign was very, very helpful in making the people realize they can reach the services. So this is much needed in this area. Collaborative platforms where government, INGOs, NGOs, institutes work together, share resources, provide quality services to the community. So one thing, there was some subcommittee in the cluster groups, but not many. And there was a huge gap in the collaboration of both government and INGOs, NGOs, and people working actually in the groups or in the clusters, in small clusters. So there is a need for a platform where people can collaborate and do collective response. Raise the public health awareness through mobile messages, local radio stations and banners. Apart from the social media, electronic media, these other mediums should also be used. Training of health worker, like I've already said, जो experts हैं, they are not much in numbers in Pakistan, but also जो need है, जैसे हमने पहले आपको share किया कि there was 28,000 calls fall on our portal, and we were not able to cater those. So in any kind of such emergency or the previous emergency, it was seen that there is a very strong need to train the health workers, especially the health workers who female health workers, and who can reach the community very easily and who can go from house to house, home to home. They should be trained in not just in identifying the psychosocial needs of the community, but also to provide the psychosocial first aid to the community. Also, there was a huge debate also on discussion on providing psychosocial first aid to the community, because this is one of the very approved model which is used globally. And if you don't have much experts in this area, you can train the people who are actually not psychologists or not psychiatrists, but you can train those people in providing the psychosocial first aid. You can train people who can reach the community at a larger number and can provide the psychosocial first aid model. And psychosocial first aid model basically to give a very, very basic kind of psychosocial support to the community before they can receive any detailed counseling. Role of educational institute, role of academia is very, very important. Unfortunately, you won't find much in this area in the educational institutes and universities and schools, and not very trained counselors are there. I think not just students can be the first respondent to provide the psychosocial services to the community because उनका दायरा कार काफी वसी होता है. So educational institute का role is very, very important. उसको emphasize करने की बहुत ज़रूरत है. Developing guidelines, evidence-based interventions. The people who are working in these areas, they can provide the evidence-based intervention. They can suggest the evidence-based interventions because they have been working in this area for so many years. So we need to have nation-based guidelines that can provide the protocols, how to give the counseling, how to give the telecounseling, how to give the psychosocial first aid, what is the meaning of psychosocial services to the community. So ये guidelines protocol, such standardized protocols बनाने की बहुत ज़रूरत है. Population-based intervention, like I already said, population 180 million population and psychosocial services needs are very, very high. So जो भी आपकी interventions हो, it should not be on the for the local small population. It should be for the wider population. चाहे वो awareness raising campaigns के through है, चाहे electronic media के through है, चाहे वो psychosocial first aid के through है. It should be a bigger population-based intervention. And of course, increase in the fiscal year health budget. Because many of the helplines actually stopped working because of the lack of funding. Many of the government initiatives were not able to sustain because of lack of funding in this area. So increase of the health budget is, mental health budget is very, very, very much required. This is our counseling helpline number 0304 1741. You can give this number further to anyone to receive the psychosocial services here. Okay, this is all from me. If you have any questions, I can answer that.
Thank you so much, Fouzia, for this detailed presentation and explaining mental health, its current condition in Pakistan, and helpline experience, and all the problems, concerns people have shared or approached Rosen Helpline. So the floor is open for question and answer. There are a few questions which I will be asking from you. The first question is, if you see someone in depression, how to convince him to seek assistance, as people are reluctant? And that is something which we also face generally in our work in the community, as well as those people who are highly educated, but they are reluctant to approach even helpline to seek psychological support.
We have also with us Ruhi, who is a senior counselor. He can also address the question. Answers. मैं थोड़ा सा इसको address कर लेती हूँ कि like counseling is a very जिसको हम कहते हैं voluntary experience, and you cannot force anyone to have counseling. कि ये आपके लिए है और आपको last में इसके लिए आना चाहिए. Depression है चाहे anxiety symptoms है, you have to make the people realize that this experience will be helpful for them. How this experience can be damaging for them and for their family, and how the counseling can help them to get through it. Or of course, because the counseling is very, very voluntary experience, so you cannot force the people to have the counseling. But once you make the people realize the cost they are paying of their mental health issues, they are mostly ready to take the help. Like I shared in the helpline, many people were calling us because of physical complaints or the financial worries. But once their main symptoms are over and the financial worries are over, they're calling us back for having the more in-depth counseling. So and similar to this, that in the depression, the psychoeducation basically works very well. And whenever you make the people realize the impact that this depression is causing to them and their families, they do come for the counselings. I can just quickly address those questions. One of the questions, did your counselor experience any verbal threats or verbal violent responses from the callers? Yes, sometimes we do. We have some protocols regarding safety and security of the callers. और कुछ ऐसे हम प्रोटोकॉल्स ऑफ कोर्स यूज़ करते हैं जिसमें हम इंश्योर कर सकें कि अगर कोई ऐसी सिचुएशन आती है, कॉज होती है, तो उसको हम किस तरह से मिटिगेट कर सकते हैं. Some of the callers who have the problems in the anger management, they do that. Ruhi, do you want to add anything in both of the questions?
Ruhi, are you with us?
अच्छा अब हो गया. Sorry, I was trying, but I can't open my mic. Yes, I have a caller of OCD and anxiety, and I referred her to the psychiatrist, and it was very difficult, very challenging for her to take the medicine. और हर कॉल में हर मेडिसिन लेने से पहले she called me और she said कि मेरे लिए बहुत मुश्किल हो रहा है, क्योंकि वो बहुत एंक्शियस होती थी. तो उसका ये था कि मैं दवाई लूँगी, इसके साइड इफ़ेक्ट, तो वो रीअश्योरेंस मांगती थी मेरे से. बट विद द पैसेज ऑफ टाइम शी टुक द मेडिसिन्स एंड नाउ शी इज़ मच बेटर. और शी इज़ वेरी थैंकफुल कि आपने मुझे बड़ी सपोर्ट दी, और अब दवाई खाने के बाद आई एम फीलिंग मच बेटर. इसी तरह जैसे आपने वर्बल की बात की और फौजिया ने बताया कि हाँ, वर्बली एक दो दफ़ा मेरे साथ ऐसा हुआ है कि शी वॉज अ बॉर्डर लाइनिश पर्सनैलिटी, एंड उसकी काउंटर ट्रांसफरेंस बिल्टअप हुई और शी वेरी मच अब्यूज्ड, वर्बली अब्यूज्ड मी, क्योंकि उसने मुझे बहुत गुस्सा किया, बहुत डांटा, और उसने कहा कि आप मेरी कॉल नहीं उठा रही थी और मैं आपको बार बार कॉल कर रही हूँ. क्योंकि समटाइम्स ऐसा होता है कि हम किसी और कॉल पर होते हैं और हमारे लिए पॉसिबल नहीं होता कि हम अपने पहले वाले क्लाइंट को लें जो दोबारा जो कॉल कर रहा है. तो शी बिकम वेरी एंग्री एंड वेरी अब्यूसिव. During the call, did you briefly share how you actually engage? जी, जो mentally, मुझे एक suicidal person ने female ने call की. She has the medicine on her hands, and she told me कि she is very mentally disturbed and she want to talk, and उसको मैंने time दिया, and she talked me almost 45 minutes. और फिर उसने share किया कि मैं बहुत बेहतर हूँ. और फिर उसने जो उस वक्त वो अटेम्प्ट करने लगी थी, मेडिसिन लेने लगी थी, बट आफ्टर द सेशंस उसने अपना आइडिया जो था वो ब्रेक कर दिया और उसने सुसाइड नहीं की.
एक क्वेश्चन है कि how you manage to prescribe medicines. We normally don't prescribe the medicines. We know because we have a team of psychologists and counselors here, so we refer them to the psychiatrist. और हमारी referral का अपना एक system है. We tend to have very detailed orientation with our referees, और फिर हम उनके साथ पूरा एक referral का system है जिसके through वो हमारे referral list में enter होते हैं. And when there are people who wanted to have medicines और हमें लगता है कि वो psychiatrist के पास जाना चाहिए, they are referred through that referral list to that psychiatrist.
Thank you, Fouzia and Ruhi. I would like if someone want to add, those who are general physicians and experiencing, if they have faced it in their practice, if there was any patient who came and they found it with the symptoms of stress, depression, anxiety. So what normally is your practice, how you refer them, or you prescribe any muscle relaxant, or what's the practice? So we just want to know about it. Any of the doctors? There are lots of doctors.
Yeah. So how you identify the psychosocial needs of your clients and how you refer them?
Thank you, Dr. Asad here. ये जो question है ये it crops up in our in practice time and again actually.
Yeah.
और हमारे जो GI disorders हैं, आपको पता है functional dyspepsia और irritable bowel syndrome और ये सारी चीजें जो हैं ये we see them day in and day out. The problem is हम usually we guide them. अगर symptoms बहुत severe हैं तो हमारे पास जो option है वो psychiatrist की है, which I must admit doesn't work very well. जो काउंसलिंग का है, आई थिंक वी हैव टू मोर लुक इनटू इट, एंड दैट्स वन ऑफ द रीजंस आई एम वेरी हैप्पी दैट वी आर इन टच विद ईच अदर नाउ. हमने हेपेटाइटिस में बहुत ज़्यादा देखा है, और स्पेशली स्टिग्मा जो है वो बहुत ही किलिंग है, और ये एक ऐसा चैलेंज है क्योंकि in one of the localities in our because hepatitis elimination की drive जिस पे हम काम कर रहे हैं, in one of the localities female they were not getting tested because of fear of becoming untouchable. और जब हमने when we reached out to them again, so we had a lot of resistance, and even they were abusive, or आप चले जाएं, दफा हो जाएं यहाँ से, आप क्यों आ जाते हैं, so I don't know how to go about it. I mean, brief answer is yes, we refer them to जो हमारे पास psychiatrist की help है. Helpline system, I think we have to utilize it more often. मेरा वाहिद डर ये है कि आप आगे ही ओवरवेल्म्ड है विद कोविड कॉल्स. आपने हमें 400% इंक्रीज अभी दिखा दिया, तो हमारे मरीज की कॉल आपको कैसे पहुंचेगी?
ये बिकॉज इसका एक ये फियर ऑफ कोर्स बहुत वैलिड है आपका, इसलिए भी कि this rise of course was because of the COVID, which is unfortunately is not over. और जब कभी भी कोविड की एक नई लहर आती है, we have seen a rise in the calls as well. और वो नीड इतनी ज़्यादा है कि we say कि हम हमेशा ही कहते हैं we are not enough, we as a team are not enough, and we have to have more hands with us. Especially अब जो टेली काउंसलिंग नया एरिया है पाकिस्तान के अंदर, we are very much into that. People can turn towards the tele counseling more and more, and people can be trained in this area more and more. Of course, इसकी conventional counseling के साथ इसकी ज़्यादा इतनी मुताबिकत नहीं है, and people have own fears regarding the tele counseling as well. सबसे बड़ा fear ये होता है कि because you cannot see the other person on the other end of the call, so you are not very confident in sharing your personal issues with them. So ये है, और of course need इतनी, जो मैंने पहले कहा, need इतनी ज़्यादा है. Like even we were not able to cater all the calls that were coming to us through our system. So वो है, but at the very same times, we also have seen increase in call during this period of time because of the strong promotion campaigns. And we can say very confidently कि अगर वो promotion campaigns हम नहीं run करते, we may not be able to receive this much of number. So I think उसके साथ with all the services available, it's very necessary, it's very required to tell the people that these services exist करती हैं. We also tried our best. We tell the people not just about our services, but we can दूसरी helplines, government helplines, उनका भी बताया जाए, and we can train the government helpline. We trained basically many government helplines in this area, and people can refer to those helplines as well. So these are the few efforts that can be done. Lekin, of course, we are here if you refer any people, any clients to us for any kind of psychosocial support.
Dr. Bhutta from Okada wants to say something. Ji, Dr. Bhutta.
मैं ये कहना चाहता हूँ, बड़ा अच्छा प्रेजेंटेशन दी मिस फौजिया ने. बड़ा होराइजन वाइड हो गया हमारा रोजन के बारे में. पहले मैंने तो नाम भी नहीं सुना हुआ था, तो उनकी बड़ी अच्छी प्रेजेंटेशन थी. दूसरे नंबर पे मैं अभी रिसेंट इस प्रॉब्लम में से गुजर रहा हूँ. अभी पिछले हफ्ते मेरे बेटे को कोविड-19 पॉजिटिव आया, तो मेरी जो रेस्टलेसनेस और जो थी ना अपनी ज़हनी कैफियत, वो बहुत ज़्यादा एंजाइटी, हाइपर एंजाइटी हो गई कि ये क्या बनने जा रहा है. लेकिन मुझे बड़ा रिलीफ हुआ कि मेरे दोस्तों ने जिन दोस्तों ने मुझे फ़ोन किए ना, मुझे उनमें प्रोफेसर असद चौधरी साहब भी शामिल हैं. इन लोगों के फ़ोन जब मुझे आए कि यार कुछ नहीं, आप फिक्र मत करो, और उससे मुझे इतना रिलीफ हुआ कि मुझे बड़ा सुकून हो गया. और उन लोगों की दुआओं की वजह से मेरे बेटे को काफ़ी स्टेबिलिटी आ गई है. उसकी ऑक्सीजन की ज़रूरत नहीं पड़ी, उसके टेम्परेचर सेटल हो गया. मतलब ये मेरा कहने का कि ये अकेला किसी अननोन साइकोलॉजिस्ट से पूछने बंदा चला जाए कि जी मुझे ये हो गया तो आप क्या मुझे एडवाइस करते हैं। हमारे जो दोस्त हैं, हमारा जो सोशल सेटअप है, वो एक दूसरे से जब इस तरह से ताउन करता है, उसका हाल चाल पूछता है, तो उसको बड़ा रिलीफ मिलता है। तो हाँ, ये फैक्टर मैं सिर्फ बताना चाहता था। थैंक यू वेरी मच।
और ये जब हम जब ये काम कर रहे थे, we realized कि community have their own ways to build their resilience. So और ये सारी चीजें जो support, जो social support है, जो support from the other family members and the friends and relatives, that actually helped a lot during this COVID-19. Community की resilience basically इसकी वजह से बहुत increase हुई है. So दूसरे factors भी हैं, दूसरे उसके opposite factors भी हैं. Sometimes rumors की वजह से कुछ चीजें खराब भी होती हैं. Sometimes we need a specialized support for some special cases, but at the very same time, this kind of service, service that you receive from your family members is also very, very helpful, which is why we really want to promote the model of psychosocial first aid, which is more like how you can provide this how you can communicate with the other people in a way that other people can feel more relieved in these situations.
Thank you.
Thank you so much. I think, Ms. Kiran, it's time to wrap up the session. So over to you now.
Thank you very much. I would like to thank the Rosen team, Ms. Fouzia, Ms. Meerab, Ms. Ruhi, and other spokes for participating. And as Dr. Asad has mentioned, there is an announcement that palliative care echo will be happening soon. We also like to extend our thanks to our chairman, Mr. Suhail Akhtar, our director, Dr. Asad Ali Chaudhry, project lead, Dr. Amna, coordinator, Mr. Uzair, Haris in IT, and Salman for support, and Professor Altaf Alam for always being here. And lastly, Ferozan's Laboratories for unrestricted educational grant. So see you next time, and over to you, Uzair.
Thank you very much, ma'am. To everybody, Allah Hafiz till next time.
Thank you. Thank you so much.
Thank you, Sheila.
Allah Hafiz.